Well, all Canadian hospitals and long-term care homes have had to make enormous adjustments for COVID-19, and Dr. Gillian Kernaghan is the CEO of 4 hospitals in London, Ontario. Dr. Kernaghan, thank you for joining us amid your busy workload.
You're so welcome. Glad to be here.
Well, tell us about what has been necessary in London there at the 4 beds. You oversee 1,000 beds, 400 of them also are long-term care beds. What adjustments have you had to make?
Focus really in the last 2 weeks since this has started to impact Canada is to really work on how do we create the capacity within the system so that as this pandemic increases and the number of people affected and the number of people that need hospital care are affected, that we are trying to create the capacity to allow that to happen. So the focus really has been in stopping things that can be stopped and ramping up things that can be ramped up to make sure that we are ready for a surge that we sadly expect is coming.
Dr. Kernaghan, what this means is that surgeries people have waited a long time for, elective surgeries that have important words like cataracts, like knee replacements, these things are going to get bumped, aren't they?
When we face a situation like this, we look at the capacity we've got to do surgeries. And we want to prioritize those surgeries that are either emergency surgeries or surgeries that in the next about 2 weeks, 14 days, if they're not done, would have substantive impact on a person's length of life or quality of life. And so if you need heart surgery, obviously that's urgent. If you have a cancer that's very aggressive, you need surgery, whereas there are cancers that are much more slowly growing. So not having surgery right now will not impact your outcome as far as the disease. It's not to minimize the suffering that people have when they've got painful knees, painful hips, trouble with their vision, and they've been waiting for months for this appointment. We're not suggesting that this isn't difficult to deal with. We are hoping people will understand that at a time like this, the doctors and the teams need to make these tough decisions to focus on those individuals for whom surgery is urgent or emergent.
And I can see that we have a role as the Canadian public to encourage our family members and friends as they get delayed. But there is also a lot of support we as a society, that big word society, need to give to those of you on the front lines. What is your watchful word for those of us about interacting with the frontline healthcare workers?
My request would be kindness and patience. We're having to make very tough decisions, and we know that your issue feels very urgent to you. We are doing our best with the capacity we've got to meet the needs of those people that need it right now. We are also asking our physicians and our teams to connect with people by phone or through virtual visits to try and continue to meet your needs in a very different way. And so we would ask that you would be kind if you're feeling stressed, because we're doing our best, and that you would be thankful to the healthcare workers and the leaders in the system who are working relentless hours to make sure the system's there for you.
Okay. Like many Canadian healthcare workers, Dr. Kernaghan, you take belief in God to the job. How does your relationship with Jesus affect the way you are facing COVID-19?
Personally, I have a very strong faith in God, and my faith has sustained me in the very joyful times in my life, but also in the really challenging times of my life. I have the privilege of serving at St. Joseph's Healthcare that was founded by women who had a strong faith in God, and they established this healthcare system to really take the healing message of Jesus to their community. And we honor that legacy by living that legacy today and every day, but particularly at times of stress like this during a pandemic. That's a real privilege for me to serve in an organization like this.
All right. Well, Dr. Kernaghan in London, thank you very much for being there on the front lines. All the best.
Thank you very much.
Hit subscribe and the notification bell to get our weekly episodes and web exclusives.